Welcome everyone to this breakout session from the 2024 EPIC Autumn Conference. My name's Joseph. I'm policy lead at the IES and I'll be facilitating this session. The session will focus on the public health burden from noise on local authorities, and we'll be having a talk from Professor Anna Hansell. So if you were hoping to attend the session on mandatory biodiversity net gain in practice, you need to head back onto the main conference Zoom call, where that session should be just getting started. But why would you want to be there when you can be part of this session instead? We'll be focusing on noise, often considered one of the forgotten pollutants. But nonetheless, it's been widely reported that noise is the second largest environmental cause of health problems, so further attention is certainly required. As Ruth mentioned in her welcome talk at the start of today's conference, EPIC hosts a sound, noise and vibration forum. The forum works to continue the legacy of EP UK's work on noise, bringing together representatives from the Institute of Acoustics, Chartered Institute of Environmental Health, Association of Noise Consultants, Environmental Protection Scotland, UK Noise Association, the Royal Environment Health Institute of Scotland, noise experts working in local authorities, and, of course, others from across the IES family, all to take action on key issues around sound, noise, and vibration. The group also acts as a forum for discussion and information sharing, including with representatives from the devolved administrations. If you're interested in more information about EPIC's Sound, Noise and Vibration Forum, or EPIC in general, you can contact IES Policy Officer Ellie Savage, who serves as the key contact for EPIC, and I'll post Ellie's email address in the chat once we get started. Returning to the matter at hand, you've joined today's session to hear from Professor Anna Hansell, who will be presenting on the public health burden from noise on local authorities. Professor Hansell is the director of the Centre for Environmental Health and Sustainability at the University of Leicester. She is an environmental epidemiologist with special expertise in health impacts of air pollution on respiratory disease and in environmental noise and health. Her initial career was in respiratory medicine, after which she specialised in public health, and she has now been working in environmental epidemiology for over 20 years. Professor Hansell has conducted some of the longest running and largest UK studies looking at the health effects of air pollution, and is one of a small number of UK epidemiologists investigating long-term health effects of transport noise. She is a professor of environmental epidemiology and founding director of the Centre for Environmental Health and Sustainability at the University of Leicester. She's director of the University of Leicester National Institute of Health Research, Health Protection Research Unit, the NIHR HPRU, bit of a mouthful to say, Development Award in Environmental Exposures and Health, working with the UK Health Security Agency, the UK HSA, and the Health and Safety Executive, the HSE, as well as the Environment Theme Lead in the Leicester NIHR Biomedical Research Centre, BRC. Anna holds an honorary consultant post with the UK HSA, as well as with the University Hospitals of Leicester NHS Trust, and she chairs the UK Government Scientific Advisory Committee, the Committee on the Medical Effects of Air Pollution, which will be more familiar to most of us as COMEP. Anna's presentation will be followed by an opportunity for questions from the audience. You can place those questions into the chat throughout the session, and I'll put them to Anna directly. For now, though, thank you for logging in. I'm now going to hand over to Professor Hansell for her presentation. So, Anna, over to you.
Thank you, Joseph, for that great introduction. Rather later, you've probably sort of truncated some perhaps, but very pleased to be involved in this inaugural meeting of EPIC, and also great to see Yanis's talk. So Yanis and I worked in environmental epidemiology at Imperial quite a number of years ago before I moved to Leicester. What I'm going to be presenting today is some collaborative work that was actually led by the UK Health Security Agency, who we work with very closely, especially with Ben Fennick, who's the noise lead at UK HSA. So I'm just going to share my screen. So there are a few introductory slides for me to go through, and then I will spend most of the presentation going through this piece of work that we've done calculating health burdens from noise facing local authorities. And I'm really pleased to say that this piece of work has been shortlisted for the John Connell Innovation Award from the Noise Abatement Society. So we have a ceremony to attend next week when the finalists the winner will be announced. So traffic noise has been labelled, as Joseph said, the second most important environmental risk factor to health air pollution is in Western Europe. To some extent, that reflects where the evidence base is. So Currently, there's a huge amount of evidence on air pollution, certainly in terms enough to base policy on. Noise actually does have enough evidence to start basing policy on, but it is a neglected pollutant, and a lot of people are not aware of how noise not only affects our mental health in our sleep, but it also has implications for physical health. So we've had guidelines on noise from WHO for the last 25 years. First set were published in 1999, and in 2011 we had a burden of disease from environmental noise published, and then some very influential noise guidelines were published in 2018, which were supported by quite extensive reviews of the literature to make sure that they were fully evidence-based. And the issues highlighted by the WHO were, of course, annoyance in sleep, but also cardiovascular disease, cognitive issues and reading development and cognitive development in children, and metabolic diseases such as diabetes and stroke.
I was just going through some of the mechanisms by which noise affects health. So sleep is one of them. The second is the actual context of the sound and how you process it in terms of whether it makes you anxious or annoyed, which will also then have a knock-on effect of physical health. And some of that relates to who's actually producing the sound, all sorts of expectations around fairness, threat, your previous experience. Some people down-regulate their response to sound. Other people, the more they hear it, the more exaggerated their response might be to it. We also have an issue that some people have chronic health conditions that can impact on how you respond to the sounds and how your body physically reacts to it. So there's been a lot of attention to these mechanisms in the medical field. So you get large diagrams like this being produced in some of the medical literature, and they're really complicated. I usually boil them down into thinking, noise is making you annoyed. It is affecting sleep. And there's also a physiological response to noise. So if you hear a sudden loud noise, your blood pressure will go up and your heart rate will go up. That's a normal reaction because it's preparing you in case you need to take some sort of action. It's the fright and flight reaction that's well recognized. And if you get that on a repeated basis, it may reset your thermostat, so to speak, in terms of your blood pressure and cortisol levels. So that's the concern. But there is good biological plausibility for the impacts of noise, and a lot of these pathways are different from the pathways that have been identified for air pollution. So the other really interesting thing that we have for noise is that there are some nice experimental studies that have been conducted. You get people in a sleep lab, you play aircraft noise to them at different times of the night, at different intensities, and you can show that in the morning there are impacts on different markers of cardiovascular stress that are already known to be part of the pathway to poorer cardiovascular health. So these were the earliest studies, 2013 to 15, but there's a number of newer studies that have now come out that are enlarging on this research. So what we're seeing, it's not just that we're seeing associations in epidemiological studies, but we know that there's a plausible biological mechanism, and we can reproduce at least the short-term effects on cardiovascular health in experimental settings. And the cardiologists have got very interested in this, and a lot of the key cardiology journals are now producing articles on effects of noise on health. So this is a review from 2024 talking about all of the mechanisms and experimental evidence, and looking at transportation noise risk in particular. So that's what most of the epidemiological studies have been concentrating on transportation noise, in part because that's a major component of noise, but also because it's been an easier type of noise to get information on. So the current figures that are put forward for the burden of disease from noise in Europe is that we have 100 million people in Europe exposed to harmful level of noise. And that's been translated to 48,000 new cases of heart disease and 12,000 premature deaths. And many million of people suffering from high annoyance due to transport noise, and 6.5 million with noise disturbance. And the combination of annoyance, sleep disturbance, disease, and impacts on mortality are combined in a thing called healthy years of life. And it's been calculated that in Western Europe, there's 1 million healthy years of life lost each year due to the effect of noise on health. So our starting point was, well, what's the burden of disease in England? So this is a paper that was published in Environment International last year. And as I say, it was initiated by the UK Health Security Agency and Ben Fenwick. And most of the work was carried out at the University of Leicester. It's highly collaborative work. So we have researchers from all sorts of fields who were involved in putting this together. So I was involved on the epidemiology and looking at the exposure response estimation through review of the literature. We had exposure science estimates, exposure science experts involved. Data science, visualization, and comms have all been involved in putting this work together and disseminating the results. So we relied as our primary source of information on noise the data that's provided by the environmental noise regulations, which were an EU requirement that has, I think, been it is continuing. So since 2002, we have a legal requirement to produce noise maps for major noise sources and basically city areas. So I think that's quite key to hold in mind, because while the end data are fantastic because they give us information we didn't have previously, they do have limitations. So they're looking at the noisiest or likely to be noisiest areas and in the location of noisy facilities. So there's definitions around how noisy a road needs to be, or how likely to be noisy a road is based on vehicle passengers. Railway is number of train passengers, and civil airports with large numbers of movements. So that's obviously a limitation because smaller airports are producing noise, branch lines on railways are producing noise, and minor roads are producing noise. So as part of this piece of work, we also looked at what happens for road noise, for example, if we include the minor roads. And we developed a model. This is a model developed originally by John Gulliver, who was at Leicester, is now at City St George's University, to model noise for population exposure estimates and for use in epidemiological studies. And we extended the methods that were being used for the end noise estimation to look at minor roads as well. And if you look on the bottom right of the slides, we've got what the data look like if you're modeling with the end2 models. So you have a truncation at 50 decibels, and there's a let me just there's and there's all this sort of bimodal distribution with picking up these larger sort of noise levels around the major roads. So if we're modelling the bottom right, the Knossos model includes the minor roads as well. So we've been able to pick up higher exposures in general. We have more adults exposed to higher noise levels than if you just use the major sources of noise. That shouldn't be a surprise. And we've also been able to look at the lower end of the distribution, because your response to noise doesn't stop at 50 decibels. It's been used as a, to some extent, arbitrary cutoff that doesn't reflect the health evidence where we've actually had data that are modelled below or available to us below 50 decibels. And I will pick up questions on noise metrics at the end of this presentation if we have time. So this is the burden of disease toolkit design. So we started off this top left systematic review. So looking at the literature, what does the good quality literature tell us about the relationship between noise exposure and ill health? So we use that to derive risk estimates. We also need to know what the noise estimates are in terms of population exposure. We can then combine that with information about how prevalent, how much disease there is already, and work out what the attributable fraction is related to noise. We bring in demographic data on mortality rates, life expectancy and population counts, and we can calculate the environmental burden of disease. And the metric that we've used is one that's very widely used in this type of calculation, which is the DALY, or disability adjusted life years. So it's a combination of the premature death, years of life lost, and years lived with disability. So it's not the most automatic of concepts, I think, but it is quite a useful way of trying to look across a number of disease outcomes and impacts on life, and work out what a sort of global figure might be in terms of the impact on health. So there are various weightings that have been agreed internationally on the years lived with disability and how much a particular disease impacts on your life. And then there are definitions of the years of life lost. So this is years of life lost below 65 years of age. And combining those two gives you your disability adjusted life years, or DALY. So to think about which diseases and calculations we might put into the DALY, this was evidence-based. So part of our work at Leicester was to review the literature on this and find some good evidence base for our calculations. And we were able, for road, rail and aircraft noise, to get good quality evidence on effects on annoyance and sleep disturbance. For road and aircraft noise, there was also good evidence on ischemic heart disease. And then for the other diseases and conditions, we were able to look at stroke and diabetes for road noise. So that relates to the amount of evidence that's out there, because there really haven't been very many studies looking at stroke and diabetes in railway noise and in aircraft noise today. So you might also be questioning at this stage, well, saying, aren't these sources also giving out air pollution? So as part of this review, we also looked at the literature to see whether some of the effects that were being attributed to noise might actually be due to air pollution. And we looked at over 50 papers that had considered this. And the conclusion was from our review that these were independent effects. So that probably shouldn't be surprising if you remember back to the beginning of the slide when I was saying that the mechanisms for noise and the mechanisms for air pollution, there were distinct mechanisms, so it shouldn't be a surprise. What we don't know is whether air pollution and noise exposures interact in terms of their effects on health, because there just haven't been many studies that have investigated that to date. So in our analyses, we found that 40% of the population are exposed to more than 50 decibels of LDEN, which is a measure of noise over the 24-hour period with a weighting for nighttime for road noise. And 27% of the England population were above the WHO 2018 noise guideline, which was based on health studies. Fewer people are exposed to rail noise. And I'll just remind you again, this is based on the ENDS data. So this is based on the major railway sources, major road sources, major aircraft, major airports. So we've got 2.9% of the population that are above the noise guidelines for rail. For aircraft noise, we cannot currently get data below 50 decibels. It's not being produced nationally. And the WHO air quality guideline is 45 decibels. So we know that around 5% of the population are above 50 decibels, which means there's a much larger chunk of the population that are going to be above the WHO guidelines. So we carried all this through to calculate the disability adjusted life years due to exposures from the major road sources. So on the top, we've got road, rail and air. The y-axis total attributable dailies, and on the x-axis we've got the different regions. So you can appreciate just from looking across that there are a lot of differences by region. And then if you look into that by colour, the green here is highly annoyed, the blue is highly sleep disturbed, we've got an orange for ischemic heart disease, yellow for diabetes and a red for stroke. So you can also appreciate that while the highly annoyed and the highly sleep disturbed are contributing a big bulk of these disability adjusted life years, that actually the relative percentages do vary regionally. And the bulk of the dailies are coming from the road rather than the rail and the air sources. So at the bottom, we've got the proportion of attributable dailies here. So it's the same information displayed as a percentage of total 100%. So you can see that the rail noise, we were only able, I'll just remind you, we were only able to look at highly annoyed and highly sleep deprived because we had some confidence about the relationship between exposure and outcome. So we've not looked at the disease-specific outcomes, and similarly for aircraft noise, more difficult to look at other disease outcomes. So if you look in the paper, there are quite a number of maps, and the maps show the differences by region across England. So this work was initiated by Public Health England when it was Public Health England. So it's not a UK focus, but UK Public Health England then became UK Health Security Agency. But the work that we'd started was specific to England. You can see that there's some spatial variation in the areas affected, with some clustering, particularly around the London area and in the northwest. So one of the really nice bits about this work is that there's some very comprehensive appendices so that you can look up your local authority for attributable burden of disease due to transportation noise for road, rail and aircraft. And it gives you the dailies for each of the conditions that we've looked at. So there's a series of tables like this, which gives your region and local authority, and it gives you the estimated daily rate for highly disturbed, highly annoyed, for ischemic heart disease, diabetes and stroke. So this is just an example for railway noise. I've had particular interest about aircraft noise at night, and I'm in Leicester and Leicestershire. So it's in the middle of the country here. This is the East Midlands Airport, and that's quite an interesting airport because it has flights going all night. Some airports have night noise restrictions. And in fact, if you look at the burden of disease due to noise, you can see that for the East Midlands, which I've highlighted here, so this is in the tables, that it's got an appreciable highly sleep disturbed rate and a highly annoyed rate, and also an ischemic heart disease rate. And those rates are the highest in any area, any local authority in England outside of the London area with the larger airports, the Heathrow, Gatwick, Stansted. So that's been quite useful in some discussions we've had when we've been setting up a health determinants research collaboration with Leicestershire County Council, and it's one of the areas that I hope we might be able to do some more work looking at. So just a few slides to wrap this up. There's been, I think, good media coverage on this to help highlight the work that we're doing and highlight impacts of noise. We've been working on doing a number of presentations so that people are aware of this work and are able to use it and engage with it. And the work was quoted by the House of Lords, a select committee on science and technology. They published a review last year on neglected pollutants, effects of artificial light and noise on human health. So I gave evidence to that review, as did Ben Fenwick from the UK Health Security Agency. And the House of Lords highlighted this burden of disease work in the publication of their report. So it's just here about the UK Health Security Agency suggests that in 2018, 130,000 healthy life years were lost in the UK, and 40% of the British population are exposed to harmful noise levels from road traffic. The other thing that they highlighted, which is really great, is that we need to keep updating our burden of disease calculations. There's a huge amount of work going on looking at noise and health impacts. And we need to keep an eye on that if we're looking at how much this is affecting the population. So the work's been picked up by National Highways Office of Rail and Roads, Rail Safety and Standards Boards, which is great to see. And there is a blog post on this on the UK Health Security Agency, which is probably a good starting point for you if you're less familiar with the issues of noise and health. So I have a minute or two, I think, if I can just wrap up. So we've just looked at this bit in the middle, population living with disease and premature mortality. There are lots of other potential costs from noise, particularly that might impact on a local authority in terms of noise intervention, and thinking about regulations and placement of new developments. And the noise costing guidance is being reviewed in DEFRA and updated currently, and we've had some interesting discussions around, for example, say hypertension and how one might cost that. So I'll leave you with this as my final slide, and thank you very much, and apologies for the issues with the sound earlier on.
No, thank you, Anna, for that excellent presentation. I really liked it. It was so well grounded in those mechanisms at the start for how noise affects health, which really I think sets the stakes for what it means for people and ultimately for public health. I think we've got a really comprehensive sense of that evidence base and what it means in practical terms for local authorities, but also for all of us. And I agree with Michael's comment in the chat. It's a really fascinating piece of work, and I think it gives us all a lot to think about. Now that we've heard from Professor Hansell, we have the opportunity for her to answer some of your questions. As a reminder, if you have any questions, you can either put up your hand on Zoom or you can post your question in the chat box, as some people have already been doing. And I'll try to select some of the best questions to put to Anna as we go. But in the first instance, Anna, I'm going to take the prerogative to ask you a question of my own, which is what challenge would you put to us? I mean, EPIC and its sound, noise, and vibration forum, that we do have quite a strong convening space around some of these issues. What should we be doing to support this agenda? What challenge would you put back to us?
One of the biggest challenges, I think, has come from the House of Lords Select Committee report and the government response. So the government have really not given. I know this is being recorded, but so it's what I might call a flabby response to the recommendations. And one of the recommendations was to set up a body that would consider health impacts of noise and sort of wider consideration of the evidence, which the government have not felt that is needed at this point, but the House of Lords did, and they have written back to the House of Commons and asked them to reconsider. So I think that's an issue that could be raised. The other challenge that we have is actually the teams that are working on noise in both DEFRA and UKHSA are small and very hardworking, but they are stretched. And I think that's another area that government could be pressed on. So the government's very interested in preventing ill health, and this is part of prevention. So if we've got evidence, we need to be able to get it out there, as we know from the implementation science, and we need to be able to change policy based on the evidence. And that is really hard, and it's particularly hard if you haven't got people in place that can help develop that. So I think that IES can and EPIC should be well placed to give a voice for that.
Absolutely. Well, I think we definitely take that challenge, and I think you'll be pleased to see that Christopher, who chairs that Sound, Noise, and Vibration Forum, has asked exactly this in the chat, which is with regards to the committee's report and its recommendations, how can we best make that case? So I think maybe it's one that we should stay in contact about after this session, and with as many people on the call who want to be involved in that, so that we can have that shared voice to continue to advocate for those really important recommendations. So I think we take that point definitely. Before I'll bring up some questions in a moment, but I've got a very difficult question from Nick in the chat, which I'll put to you first, which is, can the slides be shared?
Yes.
Yes, perfect, absolutely. Well, we'll do that afterwards. But let's bring in a question from Richard Knightley, who I see has a hand up. So Richard, do you want to unmute and say your question, please?
Yeah, thank you. And thanks for that, Anna. It was a really interesting talk. I work for, I manage an environmental protection team at Manchester City Council. So we deal with land contamination, air quality, and noise. And where health is concerned, I think we all agree that prevention is better than cure. And I know that local authorities, EP teams, licensing teams tend to deal with noise impacts retrospectively through the Environmental Protection Act, statutory noise nuisance, public nuisance, etc. Whereas I'm sort of a big believer in the planning regime, and that with new developments, if you can get the planning right, then you get a lot of these other things right, and you don't have problems, you don't have to deal with things retrospectively. However, when the planning system was changed a number of years ago by the coalition government, PPG 24 went out of the window, and with it, so did tangible noise criteria, targets, etc. So now the government talk about impact criteria. So it's quite subjective in a way. There's no real levels. So I think to link up what we need to do in order to address the noise problem I think we perhaps need the government to relook at the planning system and to make it a little bit more robust and intuitive and effective. And I don't think it's as effective as it used to be, unfortunately. And, like I say, I think local authorities' hands are tied in this respect, outside of any commitments with regards to the Environmental Noise Directive, Highways Agency, Highways Departments, etc.
I totally support that. It doesn't feel joined up at the moment, and we're knowing, we're discovering more and more about health, and then we've got new developments and schools and old people's homes that are being placed near to busy roads, and we don't have evidence or direct evidence on whether or how good noise insulation is in terms of mitigating those impacts. And one of the issues that we have is we don't have all the metrics that we'd like to see. So, for example, with flights, noise at night from flights, we get an average noise level over the nighttime period, but people are not woken by an average noise level. They're woken by a plane going over, and probably the number of noisy events going over your house is going to give you a much better idea of what's important for health and what's important for sleep or good sleep. And we don't have that, we just don't even have the data supply to be able to provide the evidence on that. So I have to say, your concerns with planning, I think you're thinking more around sort of roads and maybe trains, but we've also got an issue in terms of airports for people who've got airports in their patch, because a lot of the airports are now under pressures to expand. And demand to expand, but that also has an impact on the local population in terms of noise. So, there's a lot of areas where I think teeing up planning and health evidence would be, is needed.
Amazing, thank you, Anna, and thank you for that question, Richard. We've seen a lot of people in the chat agreeing with exactly the point that Richard's made, as well as Deb's asking a question, which I think you've actually more or less answered there as well, Anna, about how we keep unaffected, quiet areas quiet, with a view to that prevention that you talked about a little earlier. And
I'll just talk on that.
No, please, please do.
There is, we know that there's a difference between the sides of the house, for example, in terms of quieter areas of the house, and that might actually be quite important. And some groups have been looking at that. That protection of a quiet area could be quite an important defence against noise pollution.
Absolutely, I think that's a very good point. And we'll hopefully come to Jacob next, who has a hand up.
Yes, I do. I do agree with that. I am aware of the point of how having noise reduction things in things like airports. I was just wondering, the airport I mainly go to is Manchester Airport, and that can be a bit noisier times as well. So, just wondering, what are some of the noisiest airports that are most significant for contributing to noise pollution so far?
Well, Heathrow is by far the biggest airport in the UK, and it has a very large population nearby. So in terms of impacts on health, it's going to be dominated by Heathrow. And we found that when we've done research onto our international airports, that Heathrow is the bulk of both the population exposed and the health outcomes, because there's so many more people exposed and because it's very busy.
Mason, thank you. I'd love to give Nigel a question if it's a very quick one, Nigel. We're really up against it for time, so ideally a very quick one, if you can, Nigel.
Thank you. Yeah, I was just wondering if there's been any modelling done on the benefits of the move towards electric vehicles in terms of the noise modelling. Obviously, that's more benefit at lower speed roads, because a lot of the noise at higher speed roads is road tire noise interaction. So has there been any work done on that, Anna?
Not that I'm aware of. I've discussed with Calvin, who's the lead of the paper that we wrote, who's a modeller, and we thought about it, but actually the percentage of the fleet that's electric at the moment is quite low. So I think at the moment it would be more theoretical than backed up with empirical data.
Amazing. Well, thank you, Anna, and thank you, everyone, for those questions. I'm afraid that is all that we have time for, but thank you for asking your questions.